Welcome to the Psychology World podcast. I'm Connor Whiteley, bringing you psychology news, articles, and other interesting psychology-related articles. You can find the podcast notes and more interesting psychology-related things, and you can get your free 8 psychology book box set at connorwhiteley.net. Now let's get on to the show. Hi everyone, and welcome to episode 157 of the Psychology World podcast with me, Connor Whiteley. And today's episode is on, is there a better model for diagnosing mental health conditions? And it is Wednesday the 15th of June 2022 as I record this. So to be honest, this is actually one of my top favourite episodes for actually quite a while, because this is just because if you do clinical psychology, then you absolutely know about that. This is the sort of area and the sort of direction where we actually need to be going with mental health and diagnosis, and I'm actually going to explain a lot more on it in today's episode, so I won't actually do too much of an introduction here. But if you absolutely love mental health, clinical psychology and more, then this is an absolute must listen to today. And to be honest, I actually felt quite guilty, first of all, that there wasn't actually going to be a psychology news section, because this episode is going out on the Monday, which is 2 days after I've come back from my holiday. But I'll talk more about that next week though. But that's why you have the little in between episode on Thursday to sort of make up for the lack of psychology news section. And as always, I always love to hear your thoughts and feelings on today's episode. So you can always email me, connorwhiteley.net. You can always leave a comment on the show notes at connorwhiteley.net/podcast. And you can always tweet me on Twitter at sci-fi-whiteley. I always love to hear from all of you because it really helps make the podcast feel more like a conversation. And today's episode has been sponsored by Formulation in Psychotherapy, which is a really good sponsor for today's episode. Because Formulation in Psychotherapy, that is also another direction which is actually quite parallel for what we're talking about in today's episode. So if you want a really easy to understand and a really fascinating book that actually talks about tailor-made therapy, which is what Formulation actually is, then you absolutely have to buy this. It's a really great book. So that is Formulation in Psychotherapy, available from all major ebook retailers, and you can get the paperback and the hardback version from Amazon, your local bookstore, or your local library if you request it. So we're moving on to the content part of today's episode. So we're going to be talking about, is there a better model to diagnose mental health conditions with? And because there's a lot of great information here, I'm actually just going to dive into it. So if you talk to any clinical psychologists or mental health professionals, they will tell you that there are many flaws of the current diagnostic model, like the Diagnostic and Statistical Manual of Mental Disorders Edition 5, the DSM-5 GME. Again, I really don't like saying the full name. This model proposes that mental conditions exist in a case where you even have them or you don't. Clinical psychology has known for ages that this isn't how mental health works, as they exist on a continuum, so a new model is needed. Thankfully, there has been a lot of hope for a new psychology model called Hierarchical Taxonomy of Psychopathology, also known as HiTOP, and that is definitely how I will be saying it for the rest of this episode. What is the HiTOP approach? So I'm not going to go into too much depth about the problems with the current all or nothing model of a diagnosis that always misses out too much important information and misses the important something in between action, because I've mentioned it on the podcast before, in books, and it is very well documented. Therefore, over the past 20 years, there has been a call within psychology for the old DSM system and to replace them. And this call has been gaining strength and momentum ever since, resulting in these efforts causing and coalescing into what's known as the quantitative classification movement. With this being a group of scientists with the goal to get rid of the traditional reliance on a priori non-tested assumptions about mental health conditions, like the idea that they're categorical when they aren't, and have replaced the system with a new dimensional model based on the findings about the actual organisation of psychopathology. For example, the system will provide a more useful guide for patients, clinicians and researchers, as well as enabling psychologists to study and treat characteristics that are common to a range of conditions. In addition, the HiTOP approach uses statistical procedures like factor analysis, to identify constellations of co-occurring signs, maladaptive traits and symptoms. Then the approach organises them into a hierarchy based on a pattern of associations, resulting in this model that certain mental health constructs, like externalizing behaviours, are measured and are regarded on a continuum or sliding scale, if you will. And personally, I definitely will. In the exact same way how medical doctors think of a blood pressure or viral lows, leading to the different levels of the construct being empirically associated with different common outcomes, and treatments are being assigned based on these risks. Personally, I think that this approach so far sounds very promising. Like a formulation, it is about moving mental health in now to the future and advancing it, moving away from outdated models that don't work as effectively as they could, due to new research casting a doubt on them. As well as it is important to keep moving forwards because, as I mentioned in my clinical psychology reflection book, the unofficial mandate of our clinical psychologists is to absolutely help people improve their lives and decrease their psychological distress. And if this HiTOP approach is something that can help us do it, then we must consider it and advancing the field of mental health forward. Research on the HiTOP approach. So it turns out that the HiTOP approach is actually the result of the research into new dimensional approaches of mental health, with HiTOP itself looking to empirically identify psychopathology structures in a person according to the Renaissance School of Medicine at Stony Brook University. Open quote. Combining individual signals and symptoms into homogeneous components or traits, assembling them into empirically derived syndromes, and finally grouping them into psychopathology spectras. And of course, as you all know on the podcast, right, that I don't like big, complicated definitions. So in much easier terms to understand, that the HiTOP approach seeks to match a person's difficulties and their behaviours with fundamental dimensions of maladaptive behaviours. For example, matching a person's depressed mood and negative cognitive style with some dimensions that giving you depression. And for the time being, that is the easiest way to think about it. Yeah, well, just so I don't get tons of emails from people actually working in this field, because I'm just trying to introduce this to more people. What are spectras in HiTOP? In the HiTOP approach, you will have 6 different spectras so far, and each one includes both the psychopathology symptoms and maladaptive traits, which are parallel to each other on different time scales, as well as each of these traits capture relatively stable and typical chronic personality tendencies, all while symptoms tend to reflect the current acute picture of a person's mental health, with these 6 spectras being a thought disorder dimension. This dimension ranges from normal reality testing to maladaptive traits of psychoticism to hallucinations and delusions, as well as encompasses symptoms and traits commonly seen in bipolar and psychotic disorders. Internalizing dimension. The second spectrum focuses and accounts for the comorbidity, having 2 or more conditions at the same time that can be found in conditions like anxiety, depression, PTSD, eating disorders, OCD, and sexual dysfunctions. Attachment dimension. Rather similar to personality traits to some extent, this dimension ranges from introversion to maladaptive detachment to blunting affect and a violation. As well as the easiest way to think about this dimension is that it covers symptoms that are commonly seen in avoidant personalities. So if you cast your mind back to learning about Bowley and avoidant detachment, this is what this dimension focuses on, more or less. Antagonistic externalization. Then on the flip side, this dimension doesn't focus on avoidant personalities, but instead accounts for the comorbid symptoms in other personality conditions, like those seen in borderline personality disorder and paranoid personalities, something that I must cover on the podcast at some point. I should probably make a note of that at some point. Stomatoform dimensions. I really apologise if I've just butchered that pronunciation. The penultimate dimension focuses on psychosomatic symptoms, with it focusing on conversion disorders and other representations of psychological symptoms in physiological ways. For example, in a conversion syndrome, people have symptoms that are common with neurological disorders, but there is no physiological explanation for the symptoms. Or another example is that people who cannot walk despite there not being a medical reason why. However, this dimension is only added in the HiTOP approach provisionally, as the current evidence for the dimension is ambiguous about whether or not this dimension is actually unique from the internalizing dimension. Disinhibited externalization. The final dimension of the approach accounts for comorbidities amongst conditions with conduct disorder, antisocial behavior, substance abuse, and attention deficit hyperactivity disorder. Bringing it more together. So in an effort to bring everything more together, because believe me, I know this is a lot of information, writing this out was quite you really did need to, well, not so much go slow, but you needed to really focus on it. Okay, but research is continuing in the model, while with the focus being refining our understanding of the dimensions, as well as evidence from a 2020 study suggests that those spectras might be able to be combined into a superspectra. For example, emotional dysfunctions combine the characteristics of internalizing the stomatiform spectra. And I must add that would really help us to solve the ambiguous problem with those two dimensions. In addition, the psychosis superspectrum might be able to combine the fault disorder and the detachment spectras. However, what is most important of our psychology students and the professional learning about this for the first time, which I am, is that above all of these complex words, like a spectrum could sit a general psychopathology dimension, containing common features to all mental conditions. Again, we don't have that sort of overarching understanding with the current DSM model, but we are able to look at all the mental conditions and to see if there are any links that are between them, because in the DSM model, everything is organized into concrete categories with a minimal overlap allowed. As well as I might have thought about it when I was explaining the 6 dimensions. But there is ongoing research onto refining the different dimensions themselves, because in their current state they do cover a lot of ground. That could make it difficult to narrow down the different conditions potentially. That's why they're examining sub-factors of each dimension, such as for the internalizing dimension. It has been found to have 2 very distinct subgroups: the distress factor that is evident in PTSD, generalized anxiety disorder, and depression, as well as the fear factor that is present in OCD and panic disorders. Bringing it all together and conclusion. So I know in this podcast episode I have introduced you to a lot of new information, and I won't lie, it did get complex at times, but now we have all of the information. Let's bring it all together. The HiTOP model is a very new model, but that has thankfully generated a very needed argument about the concerns that different people have about its practical and theoretical limitations. For example, one critic points out the HiTOP model provides very little specific guidance on how HiTOP will help create a classification system for mental conditions that are based on causes and mechanisms. However, the entire point of this new approach is that it still might be very early days for it in the long term. Yet the research on the model has been promising, like a study from 2021. And the different HiTOP dimensions seem to account for different psychopathological impairments better than the DSM diagnoses. Additionally, these dimensions have been shown to predict future onset of conditions and symptom timing better than even current or past DSM diagnoses. Also, a study from 2019 showed that because of the DSM's problems, community clinicians often don't select treatments according to the DSM diagnoses, since they're already focusing on their symptoms and the person's signs and experiences. Overall, while clinicians are already aligning their thinking with the HiTOP approach rather than traditional diagnoses, so why not make this approach official? Personally, that's something I just don't understand, because under the current system, we just give clients a label based on an unempirical category. But if the HiTOP approach is successful, then we will instead give our clients results from scientific tests, from a good solid psychopathology and personality dimensions to generate a psychological profile. These profiles will replace these labels, and the cutoff scores will replace categories, as well as these client profile scores, along with the scores on the different dimensions, will correspond scientifically to certain genetic vulnerabilities, functional impairments, neurobiological factors, environmental risk factors, and psychological abnormalities. Then it is all of this data that will be used to guide the treatment instead of some categorical thing that the research doesn't support. So to wrap up this rather longer than expected podcast episode, as a clinical psychology students and the professionals, it isn't a secret how not ideal the DSM system is, and that it does need to change. And in an effort to advance mental health and to meet the unofficial clinical psychology mandate, it is absolutely imperative that we advance the system we use to diagnose the mental health conditions. And hopefully, just hopefully, the HiTOP approach might be the way to go. So I really hope that you enjoyed today's episode and that you got something out of it. I know that I definitely did, and to be honest, this really does make me quite excited about the future. So hopefully this will actually come true though, because the DSM, these labels and everything else, is not ideal. And to be honest, we do need to modernise clinical psychology even further. Of course, this will be very hard because you will still have the people in the NHS and the people making the decisions all over the world that will be flat out against this, but we've got to try. So if you know someone who would enjoy today's episode, then please share it with them. I'm always really grateful when you wonderful people help us spread the word about the podcast. And definitely check out Formulation in Psychotherapy, available in all of the usual places. But if you don't want to buy a book, because you still want to give the podcast a bit like one-time support, then you can now buy me a coffee at buymeacoffee.com/Connor Whiteley. So have a great day, everyone, and I'll see you next time. Thanks for listening today. I hope you enjoyed it. If you want to see the show notes, then please go to connorwhiteley.net. And if you want a free 8-book psychology box set, then please go to connorwhiteley.net. Have a great day, and I'll see you next time.